Myself, Dr. Sadhna Mukhi, Associate Professor at Sanchiti Institute for Orthopaedics and Rehabilitation, College of Physiotherapy, Pune. Welcome to everyone for Physio-TV webinar series. Today's topic is Environmental Physiotherapy, a New Direction. Now, why this topic? We all know that there is no planet B, and healthcare has a huge environmental footprint. But as physiotherapists, we have the power to make a positive impact. By embracing environment physiotherapy, we can reduce waste, promote sustainability, and create a healthier planet. Let us join us as we explore the latest ideas and innovations in sustainable physiotherapy. To shed light on this topic, we all welcome Dr. Srishti Banerjee, and Dr. Shrishti is an accomplished physiotherapist with masters in neurology. Her journey includes a BPT from Gujarat University. She's held roles as consultant physiotherapist and lecturer. Dr. Banerjee is an author contributing to book on peripheral nerve lesions and a chapter on aquatic therapy. She's published original articles in various national and international journals. She is an online educator and offering MOOC courses on sustainable healthcare and shoulder dysfunction post stroke. She shares her insights through various blogs focusing on neurophysiotherapy. As an author, she's explored sleep disturbance and spinal cord injury and the impact of COVID-19 on nervous system. She is one-page owner on Physiopedia. Through webinars, Srishti covers a wide range of topics including mental health in physiotherapy and environmental sustainability. Her commitment to improve patient care and promoting sustainability in healthcare is evident in her work as assistant professor at LJ Institute of Physiotherapy, LJ University. Let us once again welcome Dr. Srishti Banerjee. Yes, Srishti, you can continue now.
Right. Thank you, Sadhana ma'am and Sancheti Institute for giving me this opportunity to talk on something novel and something that is very dear to my heart. And I'm pretty sure that at the end of this webinar, you would be pretty interested in this novel area that we as physiotherapists are exploring to contribute to a larger picture of sustainable developmental goals. Right. So on your screen, as you can see, this tiny little pictures. These are nothing but these are 70 sustainable developmental goals, which are popularly abbreviated as SDGs by the UN. So these goals talk about no poverty, good health, quality education, zero hunger. So I just want you to take 5 seconds and focus on these goals because at a glance you would feel that okay, maybe as a physiotherapist I can contribute to good health and well-being. That's it, and somewhere in partnership for the goals, right? We are going to come back again at the end of the webinar, and I'm pretty sure that you will be able to pinpoint on what goals we are going to we are able to contribute as a physiotherapist. So before we begin with what is environmental physiotherapy, I just want to share something on three terminologies which form the foundation of environmental physiotherapy. So the first one is sustainability. Sustainability, in very simple layman terms, is nothing but any action of yours, any principle that you follow, anything which you can endure for a longer duration of time. I'll just give you an example. So it is New Year and you must have taken a resolution that I need to get fit, I need to get healthy. So you choose how do you get fit. So you have thought, okay, I can walk from my home to my college every day to and fro. That is going to promote my health and I'll be healthy. That is what you have thought. Now what has happened? Can you walk to and fro in all the seasons, be it winter, be it monsoon? No, you cannot, right? Sometimes maybe you're not well, maybe you do not have that much of energy that you can walk to and fro every day. So, is that sustainable for you? No, right? Instead of that, you choose a healthy diet, you choose a protocol of exercise which suits your health needs, and you endure it for 6 months. And you, at the end of 6 months, you see that, okay, I have inched near to my health goals. So that is sustainability. Any practical action, anything which you have the capacity to endure for a prolonged period of time. So when we relate this to sustainability with human civilization or Earth's biosphere, is that we as a human civilization, our actions should be such that we are able to coexist with the Earth's atmosphere, Earth's biosphere, right? We're not, our actions should not, in order to achieve something, in order to achieve development, we are not damaging the Earth's atmosphere. We're able to coexist, right? So our actions should be such that in long duration, we are not harming the relationship between ourselves and the atmosphere and the earth around. Okay. So now what is sustainable healthcare? This foundation of sustainability, when we narrow down to healthcare, is it is a definition by WHO, which says any healthcare intervention that you choose, right, which will improve a person's health, maintain a person's health, or it will restore health from diseased state, should have the least negative impact on the atmosphere, on the environment. So, World Health Organization insists on choosing certain interventions, or it emphasizes on interventions which will benefit humans while maintaining and managing their health, but will not damage the environment. So we and the environment surrounding us can have a symbiotic relationship, and we will leave behind a healthier planet for our coming generation. Right? Now, something that we are going to focus a lot on is carbon footprint. So, carbon footprint is basically the release of greenhouse gases. Major greenhouse gases is the carbon dioxide, right? So, any event or any action of yours or any action of an organization, when it leaves behind carbon footprint, is when any action will leave behind some carbon dioxide. I'll just give you an example, right? For example, you are coming to the college on your either on your own vehicle or you're taking the public transport, right? So from your home to the college, the means of transportation that you take will leave behind some carbon footprint because it is utilizing fuel, right? So it will leave behind some carbon footprint. So it can be individual, just as I am giving you this example. It can be an event. Okay, so let's take the example of this event which we are conducting. I have logged in online using my laptop, right, with the internet connection. On the other end, the host is recording using electricity, right, using a Wi-Fi connectivity. So the resources that we are using. So this webinar also has some carbon footprint because while conducting this webinar, we have used some amount of fuel, and as a byproduct, carbon dioxide is released, right? So that is event. Any organization, your and mine my college, it uses a lot of resources, right? Any place or any product. The manufacturing, for example, I am buying a packet of chips, right? So the amount of energy utilized in production of those potatoes, right, packaging and the transport, all of that is going to utilize fuel and leave behind carbon footprint, right? So now when we're talking about a coexistent relationship, so there are certain principles on the basis of which achieve this we can achieve this coexistent relationship. So the first one is One Health. As the name suggests, and I have put a logo, the this circle that you can see is the logo of One Health. So One Health is any approach that takes care of obviously healthy people, humans, healthy animals, and healthy environment. When any approach or any policy will consider all of these things, it is known as One Health approach. I will be giving you examples as we dive deeper. Right? So this framework talks about carrying out programs, developing legislative policies, uh, calling in research, which will unite these three things over an approach. Right? That is One Health. The next is planetary health. So planetary health, so One Health is something we are just talking about one intervention or one approach. Whereas planetary health is transdisciplinary. We are going across different disciplines, across different social environments, and we assess and analyze, right? We assess and analyze what are the adverse impact of human actions across various disciplines, right? Across various social environment on Earth's natural system. That is planetary health. Then eco-health examines the relationship between humans, animals, how the interaction between one species and another species can have effect on each other, right? So this we are going to understand as I take you in depth with the literature. Now, the purpose of introducing environmental physiotherapy was that healthcare as a system, right? Whenever I'm talking about healthcare as a system, think globally, right? Healthcare as a system, by the means of the interventions we use, the surgical approaches we use, right? We have become a threat to sustainability because it has been estimated that if healthcare was a country, right? If healthcare was a country, we as a healthcare would be the fifth largest emitter of carbon footprint or carbon dioxide because our just the healthcare consists of 4.4% of global net emissions. So if there are 100% global net emissions, 4.4% is just coming out of healthcare. Though it appears a very small number, it is not, right? It is a pretty large number just for healthcare, right? So this is something it looks like in pictures that how healthcare has become a threat to sustainability. As you can see on the pictures on your screen, right? The waste products, the biomedical waste, the gloves, the masks, which are carelessly disposed, is you can see a turtle being trapped here. Right? So this is how we have become a threat to the sustainability. From where does the healthcare's carbon footprint come? So there are four major sources. The first is energy consumption. So, for example, you're running a hospital, right? So the amount of energy that hospital consumes will leave behind carbon footprint, right? The next is transport. Energy consumption will be everything from air conditioners, computers to your operation theaters, ICU machines, everything, right? That will come under because still, although we are now very much aware of solar and renewable sources of energy, a large portion still depends upon the fossil fuels, right? That are the coal mines. We are still using non-renewable sources of energy, right? So the next is transport. This transport, product manufacture, product use and disposal are very interrelated. So product manufacture, for example, a very simple example, the surgical tools, the amount of energy or the amount of fuel required in manufacturing of those surgical tools, the amount of energy required in manufacture of the drugs, the packaging of the drugs, right? The ICU equipment, right? So all of these require energy. Now, this manufacturing and packaging requires energy. Now, obviously, they are not manufactured inside the hospital, right? They are manufactured in factories. So the transport from the factories to the hospital, and it is not a direct transport. There are at least two or three layers in transportation, right? So this transport also consumes energy, right? Then you use that product. For example, you're using a ventilator, you're using that product, right? So that is going to use energy. And the disposal. We know that this medical waste require or incineration. The clothing and the reusable items requires autoclaving. All of those require energy. Right? So this emissions or this carbon footprint is basically classified into three major scopes by the greenhouse gas protocol. That is scope 1, scope 2, and scope 3 emissions. So scope 1 emissions, if you talk about healthcare specifically, scope 1 emissions are they make up to 17% of healthcare emission, and they come from ambulances and anesthetic gases. Scope 2 comes from electricity and heating, as I've just discussed. Scope 3, which are a lot, they are 71%, right? And they come from the products used, right? So altogether, this becomes a huge emitting source, and it makes healthcare a threat to sustainability. It is very interesting to note that the global health emissions, right? We are talking about the global health emissions. If we look at the numbers, the emissions that are coming from the hospitals all around, they're as they're equal to about 514 coal-fired power plants, right? It makes us raise our eyebrows. That much amusing it is, making us the fifth largest emitter globally, right? So now, if we look at the literature, I'll just give you fewer concise numbers. So there was a study done in 2017 by Gonzalez et al. In Spain, and they have found that the annual amount of energy consumed in Spanish hospitals was about 0.27 megawatt per hour, right? And it is per hour I'm talking about, per meter square, 9.99 megawatt per hour per healthcare worker. And it makes up to 34.61 megawatt per hour per bed, right? This is just Spain, and Spain is not a very huge country, right? So the numbers are surprising. So we have some data across the countries. So as I said that in Madrid, Spain, small hospitals, they have named it small hospitals, hardly 200, 300 bedded hospitals, right? They have an annual energy consumption of around 40,000 kilowatt per hour, right? Spanish hospitals, they become, they roughly constitute about 20% of their tertiary sector total consumption, right? If we talk about UK, the hospitals, the healthcare sector contributes to 4% of total contribution of the United Kingdom, right? And it is equivalent to the amount of energy the hospitals in the United Kingdom uses is equivalent to about 11 coal-fired power stations, which is huge, right? And if we still narrow down, one bed, one bed in the critical care unit emits up to 7.01 kg of carbon dioxide per day per bed, right? So this is a huge number. Now, a lot of carbon footprint also comes from diagnostic tools. Ultrasound, ultrasonography emits 1 kg of carbon equivalent. Abdominal CT scan 6 kg, which is a higher contribution to carbon footprint. MRI, abdominal MRI 20 kg. Cardiac nuclear medicine 10 times higher than the ultrasound. And ECG, that is 2 kg. Pathological testing forms the 9% of total healthcare's carbon footprint, right? It has been found that Picano researched, and they have stated that one ECG, one electrocardiogram produces 2 kilogram of carbon footprint, while one MRI produces 200 to 300 kilograms of carbon footprint. Isn't it huge? It is. It is very huge, right? So this, just the pathology and the testing I am talking about, covers 1% of the total 5 to 10% of carbon footprint that the hospitals contribute, right? So it has been found that in 2016 a study was done across 120 countries, and they calculated the carbon footprint of MRI and CT scan across 120 countries, and they have found the 4% that we are seeing now, that 4.4% of total carbon emission is done by the healthcare sector. Out of that 4.4%, 0.77 is just by MRI and CT scan. So I am pretty sure these numbers are as amusing to you as they were to me when I heard them for the first time. So, what is the answer to this? How we as physiotherapists can contribute in bringing these numbers down? So, it is again, the answer is environmental physiotherapy. We'll know how. Right? So, uh, it has been established that pre-operative physiotherapy brings down the hospital stay, right? So it is pretty amazing to note that a study done by Crowley and Henderson in 2003 stated that pre-operative physiotherapy reduces the hospital stay from 10.5 days to 6.5 days. It is about, on an average, 4 days, right? So this 4 days are reduced. So the amount of resources that a hospital spends on a patient per day are reduced, right? So the overall carbon footprint reduces. Okay. So the preoperative physiotherapy reduces the post-operative stay after abdominal, thoracic, and orthopedic surgeries, right? It has been also noted that patients uh, regularly undergoing pre-operative physiotherapy, or generally physiotherapy, what they have found was that they tend to do better on ventilators, right? They require less days on ventilators with quicker weaning off, right? And eventually a lesser hospital stay, a lesser critical care unit stay, right? So pre-operative physiotherapy brings down the hospital stay. It will work on the amount of carbon footprint that is associated with hospital. Because see what happens is, I just give you an example. There is a knee replacement patient admitted. There are a lot of pre-operative procedures. Okay, after the pre-operative procedures, post-operatively, the day one after the patient is out of the operation theater, right? Following which, the amount of electricity spent on that patient's room, vital parameters monitored, the food that is being provided to that patient, right? All of this requires energy. Okay, the clothing that the patient wears is washed, autoclaved, sterilized, right? Greater the number of days the patient stays in the hospital, greater is the amount of carbon footprint. If you're staying just for 6 days, so this comes down, right? So overall, we are reducing the carbon footprint of a patient operated. Okay. And sometimes it happens. It has happened with me, and I'm pretty sure it has happened with a lot of physiotherapists. You can delay the surgery, specifically in orthopedic cases, specifically in patients undergoing arthroplasty. You are in a position you can delay the surgery, and sometimes the patient does not even need the surgery, right? So, with a lot less, we are able to bring down the carbon footprint, right? The next major problem that is faced here is the use of non-steroidal anti-inflammatory drugs for musculoskeletal pain. Very simple. You have pain, trapezitis, you can just pop in a Denemar, a diclofenac, right? And you will be fine in 4 hours. Again, although the pain will come back. It has been found that these non-steroidal anti-inflammatory drugs, they are listed among 10 persistent pollutants. Persistent means that they are continuously present in the atmosphere, right? And they can harm the environment, the underwater environment, the soil, right? I'll just give you an example before we move into this. If you know this, few years back we have seen that this diclofenac and everything is banned in cattle, right? Because for pain and everything, this diclofenac was given in the cattle, and after they died, their body was decomposed by vultures. And over the period of time, these vultures started getting extinct. Right? That is the power of these drugs. It, although it may seem like a little pill, giving you a good relief for 3 4 hours, you are able to go about your day, but they are not very safe neither for you nor for the environment. So I have this cycle here, and this is what happens when you pop a pill, right? It is orally consumed by you, it is metabolized, and it is excreted out of the human body. But these are so persistent that although they are treated in the wastewater plant and then they are released in the surface water, but these are so potent that their potency does not come down after this treatment also. Once they are released in the surface water, what happens? These aquatic animals will consume them. They get deposited in their bodies, metabolized there, but still they are so persistent. And this is all backed up by research, right? You can find the references of these at the end. And what happens is they are consumed, they get deposited inside the bodies of these fishes and everything. They are again consumed by the humans via seafood, and their cycle keeps on repeating. But this was not it. When I was talking about One Health and when I was talking about eco health, our actions are damaging to another life. This non-steroidal anti-inflammatory drugs have a very adverse effect on the kidney of the fishes. They are so potent to modulate the genes, and this mutation or modulation of the genes leads to a slower regeneration and repair of the kidneys. They affect the gills, the liver, the sexual differentiation. And if they are not properly sexually differentiated, they will not be able to reproduce. They will not be able to give or release gamete, that is gametogenesis, right? It hinders the physical development of the fish, affects the feeding behaviors of the fish. It has an adverse effect on the antioxidant genes. We know that these antioxidant genes are very much important to maintain an overall health, right? They affect the egg production, egg hatching, they affect the immunity of the fishes. So our actions are adversely impacting another life, right? They also have an adverse effect for us. We know that gastrointestinal issues and liver cirrhosis are very common adverse effects of NSAIDs. Again, we have environmental physiotherapy to answer this. See, there physiotherapy, I'm talking about mild to moderate musculoskeletal pain. I'm not talking about a surgical procedure or I'm not talking about a severe pain. I'm talking about mild to moderate musculoskeletal pain. It can be simple tennis elbow, it can be very simple trapezitis, back pain, all those things, right? Where not always it is required that you pop a pill, right? So kinesiotaping, neural mobilization, posture and ergonomic advice, massage, spinal manipulation, exercise programs, and cognitive behavioral therapy. They have been shown to show similar or sometimes even better effect than NSAIDs. So I have this study by Moria et al. In January 2016. They compared the efficacy of kinesiotaping as compared to non-steroidal anti-inflammatory drugs for subacromial impingement. And they concluded that there was no clinical difference between the use of naproxen 500 mg twice or kinesiotaping. However, 11% of their participants in the medicine group, they discontinued naproxen because of gastrointestinal discomfort and complications. However, there are no such side effects such as kinesiotaping. And on the contrary, kinesiotaping is completely biodegradable. Yet it is made up of cloth. it can be easily, it gets biodegraded, right? Apart from that, Sands et al. In 2018, they compared the effect of neural mobilization with oral ibuprofen for cervicobrachial pain. And what they found was immediately ibuprofen worked the best that we know. But these scores of pain tend to rise in the ibuprofen group. Just they increased back again before the next session. But that was not the case with neural mobilization. They showed a sustained and a persistent relief. Apart from musculoskeletal conditions, non-steroidal anti-inflammatory drugs are most frequently prescribed for tension headaches, right? So, physiotherapy techniques such as posture and ergonomic advices, massage, spinal manipulation, oromandibular treatment are alternatives for a low carbon option. Techniques such as cognitive behavioral therapy works really well for tension headache. So, according to European Federation of Neurological Society, non-pharmacological treatment should always be the first line of treatment for tension headaches. Right? So, apart from this, the other options that we can incorporate is there is this sustainable living group which manufactures biodegradable lab coats. Xlite and Woodcast are the companies which manufactures compostable orthoses. Medispo manufactures biodegradable gloves. So these are some options which we can think of while using the supply materials. Now, although we have talked that okay, physiotherapy can help in bringing down the carbon footprint, but physiotherapy is also not free from carbon footprint, right? The electrotherapy that we use, the disposable papers, and the tissue that we use, they again contribute to carbon footprint. The therapy tools. So we just wrote a blog spot on the Environmental Physiotherapy Association website. You can find this out. The dry needling that we use, the needle, right? It comes in a plastic packaging with a plastic cap. Although the needle is metal, it will get biodegraded. But the plastic cap and the uh, that packaging material that does not get biodegraded. And how many? Sometimes 10, 12 needles are used per session per patient, right? So we need to think twice before using that. So as I said, that it is a symbiotic relationship. When you are putting effort to, when you are putting an effort to restore the earth is always there to help you. So carbon footprint of physiotherapy can be addressed by moving physiotherapy outdoors. You can move certain sessions outdoors so that the whenever feasible, if the patient is coming to you for 5 sessions, you can take 2 sessions outside, right? Because when you take the session outside, the patient is exposed to the environment, to the trees, to the garden somewhere. So this green space exposure is proven to bring down the pain perception, improve the endorphin levels, right? So it is a win-win situation. Use of renewable sources of energy and decarbonizing your physiotherapy clinic. So as and when you can, you need to think of more sustainable options in your clinic, not using paper tiles or making use of maximum reusable items can help you using your manual therapy over electrotherapy as and when required. Also, not prescribing unnecessary investigations because we as a physiotherapist are very well versed in clinical evaluation, right? You may not need a MRI or a CT scan to look at a disc bulge. Your clinical examination suffices. So do not advise unnecessary investigations. It will burn a hole in the patient's pocket, and obviously it is going to have adverse effects that we have seen. So, with these principles, we have developed this Environmental Physiotherapy Association. It is a global platform. We have our members from all around the globe, and we are a network of physiotherapy clinicians, educators, students, researchers who are interested in advancing this field, what we do is we do grassroots level research, right, and incorporate this research into practice. So we began the environmental physiotherapy agenda in the year 2020, where we have collaborated with a lot of physiotherapy colleges across the globe, where we make sure that a physiotherapist should get entry level physiotherapy education in environmental physiotherapy. We want to inculcate this principle in the minds of budding physiotherapists. We teach them about environmental and human health, the relationship between them, and how you can function better when you work in a symbiotic relationship, right? So in now we, as our agenda was till the year 2023, from 2024 till 2027, we are working on refinement of these ideas. We are working on planetary health education. We are working on integrating multidisciplinary approaches in the curriculum, in practice, and in research. So till now, we have 90 physiotherapy education institutes working together towards this idea, supported by 35 international organizations, including the UN and including the World Health Organization, including the World Physiotherapy Congress, right? And we have over 700 individual supporters as well. So these are our practice partners, right? We are associated with World Physiotherapy. Uh, this SDSN is Sustainable Developmental Solutions by UN, right? So this is the QR code that will take you to the website of Environmental Physiotherapy Association, and the registration is free, right? We do not charge anything from anyone, right? Neither your institute nor as an individual. You can just scan this code. This will take you to the website. You can go to the contact us page, enter your email ID, and register yourself. Again, I say the registration is free, right? You will be receiving your updates and what we are doing as environmental physiotherapy in your mail, right? Also, as I said, that we are associated, we are welcoming the institutes who wants to get associated. So if your institute wants to get associated, you can go to the page and you can just put in a query and we will get back to you shortly. Again, the institutional association is free. There are no charges. You can just join us and contribute your insights. So before I conclude, as I said, I want to go back to the first slide. Now I want you to think that where and how we can contribute as a physiotherapist. Okay. So now you know we can contribute to good health and well-being, right? We can contribute to goal number 13, that is climate action. We can contribute to life below water. We can contribute to life on land. We can contribute to industry innovation and infrastructure, right? And obviously, we can contribute to peace, justice, and partnership for goals. So I hope I was helpful to give you a new perspective. Thank you so much for the opportunity.
Thank you so much, Dr. Srishti, and we all express our sincere gratitude to Dr. Srishti for sharing her valuable insights on environmental physiotherapy. It has surely given us some idea about what sustainability practices which we can include in our physiotherapy practice. Thank you for inspiring us once again to adopt these practices in our profession and help us reduce our profession's environmental carbon footprint. Thank you so much. Before ending, I would like to thank the technical team of PhysioTV. Thank you, Dr. Apurva sir and Manisha ma'am. And thank you once again to Sanchiti Institute for Orthopaedics and Rehabilitation, College of Physiotherapy, Pune, for giving us this opportunity. Stay tuned for more interesting content. Thank you.